Think estrogen is the end-all be-all for preventing osteoporosis? Well, it might be time to reconsider that notion. Welcome to another enlightening episode on this channel. Today we're unraveling the intricate relationship between estrogen and osteoporosis and challenging some long-held beliefs. Firstly, let's get to know estrogen a bit better. It's a hormone most recognized for its role in female reproductive health. But did you know it's also a key player in bone health? In fact, estrogen helps to keep our bones dense and strong. However, as women age and transition into menopause, estrogen levels naturally drop. This decline can lead to bone loss and an increased risk of osteoporosis. For years, many postmenopausal women have been prescribed estrogen replacement therapy as a preventative measure against osteoporosis. But recent discoveries have started to challenge this conventional wisdom. Research indicates that bone health is not dictated by estrogen alone. Other factors such as diet, exercise, and even genetic predisposition wield significant influence over our bone health. So here's the myth buster. Merely upping estrogen levels may not be the magic bullet for preventing or reversing bone loss. In fact, long-term estrogen therapy can come with its own set of risks, such as an increased likelihood of breast cancer, blood clots, and stroke. Therefore, it's crucial to balance these risks against the potential benefits and explore other strategies for maintaining bone health. To truly grasp the science of osteoporosis and estrogen, we turn to the power of 3D animation. By visualizing the bone structure and the impacts of estrogen deficiency, we can gain a more comprehensive understanding of how osteoporosis develops and progresses. Detailed animations allow us to navigate the complex interplay between estrogen, bone cells, and bone density. But fear not, there are alternative methods to protect your bones. These include maintaining a balanced diet rich in calcium and vitamin D, engaging in regular weight-bearing exercises like walking or strength training, avoiding smoking and excessive alcohol, and having regular discussions with healthcare providers to explore personalized treatment options. To wrap things up, estrogen is indeed crucial in maintaining bone health, but it's not the only player in the game. By understanding the complexities of bone metabolism and making necessary lifestyle modifications, women can take the reins of their bone health and reduce their risk of osteoporosis. Always remember to consult with your healthcare provider for personalized advice and support. Thanks for tuning in, and be sure to subscribe for more enlightening content.